Alright, so let's see if someone comes. Nobody is joining yet. Okay, I'll wait and check if some of you come up. I think I'll have to wait for a little bit more because I want to be sure that I'm audible to you guys. That's very important. Otherwise, the purpose of coming live will be defeated. So, okay, let's wait for a few minutes. Hello, so please do comment and tell me if I am audible to you guys. Hello, anyone, please respond. Write the comment and tell me if I am audible to you guys. Hello, can you hear me, guys? Okay, that's great. So now you can hear me. So I'll begin with today's Facebook Live. It's on the topic that why COVID-19 patients starts getting low levels of SPO2. What is the cause of it? This is whatever I am going to say today about on this topic is nothing unknown. It is from the textbooks. It's written in the textbooks. It's just that I mean what has happened during this pandemic times, that typically when doctors or the professionals, when we start learning new things and advanced things, we happen to often forget the fundamentals, the basic things which are written in the textbooks. Those kind of things happen quite often. So I think I'll discuss those textbook things, what is leading to the low oxygen saturation in the patients. So I will try to keep this video short because the last live was long. I tried to cover many things, but in this video I'll just focus on one thing, and one thing that is why the oxygen levels of people are COVID-19 patients are going down. So all right, when people are getting infected with the coronavirus, okay, Sunil Bodhi, welcome. When people are getting infected with the coronavirus, what happens is that our immune system starts fighting the virus, right? So when immune system fights the virus, it needs our WBC and those kind of things. They need conditionally essential amino acid that is called L-glutamine. I talked about it in the yesterday's live as well. So when body needs that L-glutamine to fight the virus, where the body gets L-glutamine from, right? So that is the question. So body, let's pose it slightly differently. People's oxygen levels are going down. So if you ask why people's oxygen level are going down, so the typical response will be because lungs are becoming weaker, right? So but why lungs are becoming weaker, right? That is the next question which we should ask, right? So what is happening is that body needs L-glutamine to fight the virus, and where L-glutamine is most abundant in the body, it's in the skeletal muscles. It's 70% of it. 70% of L-glutamine is available in the muscles, skeletal muscles, right? So since body needs the L-glutamine, it will break down those skeletal muscles to get the required amount of L-glutamine to fight the virus. As a consequence, what happens? Skeletal muscles means ribs, lungs, all these things, they are connected with the skeletal muscles, right? So when body starts breaking down these skeletal muscles to get the L-glutamine, what happens? Your lungs start becoming weak because body is breaking down your skeletal muscle to extract to get L-glutamine, right? So as a consequence, your muscles become weak, and the patient's lungs will start becoming weak, so they cannot breathe as effectively, and which leads to the low oxygen saturation in the blood, right? So that's the reason why COVID-19 patients' oxygen levels are going down. So what we can do to avoid this problem, right? So it's very simple, whatever the body needs L-glutamine. So instead of body trying to extract glutamine from our skeletal muscles, what if we provide L-glutamine from outside to the patient? When you provide the L-glutamine from outside to the patient, orally or inject in vitro through the channel, then body will not break down these lung muscles, these skeletal muscles. So and there will be ample supply. If there is ample supply of L-glutamine in the blood, body will not break down our own lungs skeletal muscle to extract the L-glutamine. So in that case, it will not be your lungs will not become weak, and if since your lungs will not become weak, you will the patient's lungs will not become weak, and that means patient can breathe easily and their oxygen saturation will not go down, right? So that's why it's very important to give COVID patients L-glutamine if you want to keep their oxygen saturation level high. If we don't provide L-glutamine from outside, the body is going to break down the skeletal muscles to extract the L-glutamine, and which is, as a consequence, you will have your lungs will start becoming weaker and weaker, which will lead to low saturation of the oxygen, right? So if any of the doctors watching it, please do consider giving your patients L-glutamine. That's very important. And along with that, give them whey protein, because it's a complete protein for fighting the infection, and body needs complete protein, not just essential amino acids. That's not sufficient, because if you provide only essential amino acids, body will have to ration its resources to produce other non-essential and conditionally essential amino acids. And in this time of emergency, we don't want body to ration its resources. We want to provide the body all the amino acids, essential, non-essential, conditionally essential amino acids, so that body doesn't have to ration the resources and it can launch full-blown attack on the virus and just deactivate it and be done with it, right? So that is the one part of the of the protein or amino acids role in the treatment of COVID-19. So I think I'll just switch. That will do for this video. I have explained why people's lungs are becoming weak, and what is causing the low saturation of oxygen in COVID-19 patients. And I want to keep it brief because medical professionals may not have that much time to watch a long video. So that should do for it. And keep safe, stay healthy, and guys, please do share, please do share this video with any medical professional even if you are not understanding what I am saying. Every single medical professional, when you saw this video, when they see this video, they will understand exactly what I am saying. So please do consider sharing it. Share it as much as you can. Let this video reach every medical professional, and we can save lives. People will not need oxygen supplement if we provide ample L-glutamine and other complete protein, right? So that's it, and I'll reply to your comments later on. And stay healthy, keep yourself protected, follow the protective protocols, and stay healthy. Okay, so that's it. Bye bye, take care you guys.